Hi guys. Apparently we sent something about, I'm going to guess about an hour or so ago, and apparently the recording didn't take. So if you're looking at that and you go, where is it? I'm right here. All right. Somebody last night reminded me about preparing you a little bit for the quizzes. Now I think I have, but in order to go a step further, I think that was a good suggestion, by the way. Um, I will give you general areas on each quiz. And now most people have done the quizzes already, but quizzes 6, 7, and 8, I will give you general areas on. Okay? So, quizzes 6. Know about bundle, branch, block. B, B, B. Okay? Now, it's sometimes called either right or left bundle branch block. So you could see that written RBBB or LBBB. So know about them, know what they mean. If you see, for instance, a QRS with a little mountain peak on it, those are two QRSs superimposed over each other. And the first little peak is called R. Okay, that's the ventricle that fires first. And the second one is called R, and then a little dash alongside of it, prime. That's the ventricle that fires second or later. Okay, that's the one that was delayed, the R prime. Know about your leads. If I say V1 through V4, remember, a lead is a camera angle of the heart's electrical activity. You can say, yeah, V1 through V4 is anterior. What if I say V1 and V2? You can say that takes a picture of the right side of the heart. V5 and V6, the left side of the heart. 2, 3, and AVF. That's the inferior portion of the heart. Okay. So know what angle we're taking, what area we're taking of the heart. This is quiz 6. Okay, we talked about the signs and symptoms of heart attack. Substernal chest pain. Pain can radiate up to the jaw, to the back of the neck, and go to the arm all the way down into the fingertips. Yeah. Person gets dyspnea, difficult, labored, abnormal, pnea, breathing, difficulty breathing. They're diaphoretic, they're sweating. Okay. If you ask them if they want you to call somebody, usually denial will come up. Nausea, indigestion. Okay, they're posturing, they're leaning forward onto something, like they're short of breath. Okay, well, let's just say you approach this person, right? And you're in the field. Is there anything you can do to help them at this point? I mean, besides call 911 while you're waiting? There actually is. Think about it. Think about some of the symptoms, what you could do. In other words, words like Trendelenburg, words like Fowler's, words like prone or supine. I mean, which one of those positions would you put them in and why? Know about nitroglycerin, what it does. I said this on one of my other tapes, remember? It's a vaso, however you want to pronounce it, is vessel. It's a vasodilator. And specifically, it opens up the coronary vessels to the heart so you can get more blood and oxygen. Okay. Know about aspirin. Okay, I mentioned 81 milligram bare aspirin. Okay, how many should you take and why? What is aspirin? Okay, as far as a heart attack is concerned, what does it do? I'm looking. Know about artifact. Alternating current artifact, somatic tremor, wandering baseline. Know about it. Know what causes it. What if you noticed it? What might you do to correct it? Okay. Remember I said, always treat a patient. never a monitor. You want to treat the patient. So yes, you want to see what's on the monitor, but you just want to go, you don't want to get tunnel vision. Yeah. You want to get myopic. You want to go, yeah, this is what it shows. Well, I wonder how my patient's doing. Okay. So find out. Right? We talked about a little bit about quiz 7. And in quiz 7, we want you to know things like rates. In other words, the SA node has automaticity, the ability to automatically fire and take over pacing. Yeah, it is the pacemaker of the heart. But what rate does it normally go at? And then if it fails, what rate does atrial? What rate does junctional? What rate does ventricular go by? Okay, we want you to know those rates. Remember, because a lot of times you can identify a rhythm by a rate. And that's one of the 5 areas that we use to identify a rhythm, is rate. We talked about the word paroxysmal, meaning sudden, right? Now that imposed something a little bit different because we said if you have a sudden tach, what is that rate? Paroxysmal. Or if you had a sudden flutter, right? Or fib came on suddenly. Remember, fib is hypothetical. Okay, patient doesn't have a pulse. Okay, but what is the hypothetical rate of fib? I'm looking. Remember, you read about, and I'm pretty sure I talked to you about emergencies. In an emergency, if a focus, an area of the heart becomes irritable, it can fire at what rate? Okay. Any focus, atrial, junctional, ventricular, yeah. Know about rates that are slow, yeah, slower than 60. Know about rates that are high, greater than 100. That was 7. Let me go off of 8. I'm just giving you general things to kind of be aware of. I'm not giving you the questions or anything like that, nor the answers. I'm giving you areas to study for, which I normally would have done at school, and I thought I did. I apologize. Good suggestion, whoever brought it up. Actually, I know, but the names and places have been changed to protect the innocent. Okay. Know about PEA, pulseless electrical activity, and this is one of the reasons I said, don't treat a monitor, treat a patient. Just because you see something on the screen, you go, yeah, they're in so-and-so and they seem to be doing okay. Are they? No cardiac arrest. 3 types, and I gave you 3 types. Okay. PEA being one of them. Know about blocks, atrioventricular blocks. Know about 1st degree AV block. Know about 2nd degree AV block, both Mobitz 1 and Mobitz 2. Know about 3rd degree, also called a complete heart block. Okay. I gave you ways on the last or the second to last video I posted, an easy way to tell about blocks. And also, here's another suggestion. Don't be doing quizzes until you're up to date on my videos. Okay? And watch the wording of the questions. People think multiple choice questions are good because are easy. because you're bound to come up with the answer. I got to tell you something. I don't necessarily think so. Okay, because multiple choice questions can be easy, but they also can be extremely hard. You got to use the information you have and apply it. You know what that's called? Critical thinking. And that's what they're after today if they hire somebody. Critical thinking. You know, if you ever watched the movie House, when he used to go up there to the board and write all those areas, yeah, that's critical thinking. That's applying what you know. Now, I wrote this to somebody today. Once again, won't tell you who, but I wrote it to somebody. Because probably some of you are thinking, well, you know, this is getting difficult in light of everything else. Well, I can understand that. I can. If you're confused about something, call me. I'll try to explain it to you simply. But here's the other thing. Try not to. You can, but try not to quit. Why? Why would you? Because something's difficult? You don't think nursing is going to be difficult? Okay. I think paramedics is going to be difficult. Sure, it's going to be difficult. But don't quit just because something's difficult. Try to understand it. Many years ago during World War II, the Prime Minister of London, Sir Winston Churchill, came to the United States multiple times to meet with the president and so forth. And on one occasion, he was asked to come speak to a college for their graduation. So he did. And they announced, you know, who he was, and he came up to the group of microphones. And this is what he said. This was his entire speech. Never, ever, never, ever, ever give up. And he walked back to his chair and he sat down. That should tell you something. Things are going to be difficult. Think. Use your knowledge. Use your willpower. Get through it. God bless. Have a nice afternoon. Hit something.